Hello, everyone. My name is Jacob Ashish. I'm from U.S. City known as Houston, Texas, the medical hub of the world. I was diagnosed with a heart problem many years back, which was a small underlying problem which I didn't take it much seriously until lately. I had an episode of heart issue. It is just 3 months back. I was referred to for further studies on it, and they discovered my aorta was completely dilated beyond a human can take it. One of the senior, most top cardio surgeons in Houston City, I had a sitting with him, and he told me, you have to go a major surgery to correct the issues as soon as possible. That's the moment I was talking to one of my very dearest, closest friend in here, and they referred me to Dr. John Valiat. I never knew this doctor. I had no idea who he is. And they said he's one of the greatest doctors over here. He's like a fatherly figure. That's the way he cares. So I was taking opinions from different places, where to fit in, where can I go do this, because it's going to take me almost 3 months of recovery time, a lot of procedures, very critical things. And all these things were, so when I talked first time when I sent all my reports to Dr. John Belliat, then he sent me a message, doesn't matter, you call me anytime, I will answer your call. So the first time I had a conversation over the phone, which lasted for almost maybe 30 or 35 minutes, because he already saw my reports. And he said, come over here, we can do this, we can take care of it.
I'm Dr. John Valiat, head of cardiac surgery at the Believers Hospital in Tiruvalla. Mr. Jacob has a congenital condition in which his aortic valve has 2 leaflets rather than the normal 3 leaflets. This is a particular disease called bicuspid aortic valve disease, and it not only affects the aortic valve but also the whole of the ascending aorta. The aortic valve was leaking and the ascending aorta was dilated to 2.5 times the normal size. And he needed a surgery to replace his aortic valve and also replace the ascending aorta, and also at the same time to implant his coronary arteries from the original aorta into the new graft tube which replaced the aorta. He consulted surgeons in Houston, Texas. Houston, in fact, is the headquarters for aortic surgery, but they offered him a metallic valve along with the aortic replacement, because according to American guidelines, for his age, which is 50, a mechanical valve is recommended. But the mechanical valve requires that the patient should take blood-thinning medicines all his life. And Mr. Jacob did not want to do that because he is an active person. And he didn't want to be bothered with taking tablets every day, which would make his blood thin and put him at the risk of bleeding in case of injury. So he was seeking a place where he would get a biological valve which doesn't require blood-thinning tablets all his life.
And the thing is that it's not just the expertise of a doctor, but rather than the love which was shared, the connection which I could establish over the phone with that doctor. So immediately I made the plans. I to book my tickets. There is no second thoughts about it. I landed here. So I came over here. Everything was instructed. Everything was taken care of from the moment. But the moment I walked into this hospital, there was a friendly feeling. The staff where you admit, I don't know, how do you call that? They were so friendly to me.
He came here and we operated on him last week. And we gave him a biological valve along with an ascending aortic graft, and we re-implanted his coronaries. This valve will last him around 20-25 years. And after that, if he needs another valve replacement, it can be done without surgery by a transcatheter technique. A valve can be passed from his femoral artery up into his aorta, and the degenerated valve can be replaced as and when he requires replacement, which would not be, I hope, for another 20 years at least.
And Dr. John was there. He was arranging everything. The very same day, I was given all instruction what we are going to do. And he was rushing on my surgery because he knew the gravity of my situation. And he was like always smiling. He said, everything's going to be okay. You're going to be great. All those things were happening. And I was introduced to Dr. Benson, Dr. Suresh, amazing people. I tell you, I've never seen people like this all my life. Beyond that, they are gods and angels, I would say.
Surgery actually is a complex surgery, even though I put it in a simple way. And it involves expert anesthesia. And I had my colleagues, Dr. Benson and Dr. Sajid, who did the anesthesia. And also we had a team of technicians who were running the heart-lung machine and to keep the patient alive while the heart is stopped for the surgery. In addition, the surgery required keeping his aorta open to do the stitching at the top of the aorta. And during that time, circulation to his brain was stopped for about 15 minutes. And for this, we had to cool the whole body to a temperature of 20 degrees centigrade. And all this is done on the heart-lung machine by the team of heart-lung technicians. And we also had a very expert, very nice team of nursing staff who helped me with the surgery. And the post-operative care was done by Dr. Benson, who is also our anesthetist, and also a team of intensive care doctors and also nurses in our intensive care.
The staff at ICU, they were like literally on the toes for me every split second. I would give a small example. I was at sedation for a couple of days because of the pain and all those things. My wires, I was wired up with a lot of machines around me. When I wake up in the middle of the night, I see somebody sitting right next to me in a chair. And when I jolt or just wake up, who was sitting right next to me? And they also stand up immediately. So I was shocked to see that they are more than professionals. I said, you are not just nurses or doctors. You are the feet and hands of God. Their love beyond everything, their love and care, that cures you a lot. I'm so thankful to this hospital. I'm so thankful to Dr. John, Dr. Benson, Dr. Suresh. So thankful to the ICU people, the nurses out there, the medical professionals, the junior doctors, and whoever in between, even the cleaning people, the people who delivered food for me, and the people out here in this HDU. Amazing. They are beyond professionals. They're angels. Dr. Suresh, you guys are beyond amazing. Please keep the good work. And thank you for this opportunity. Thank you for giving this hospital right here, the cardiac center. That's all I know. I don't know the rest of the areas, but I've seen much of them because I've been taken for the x-rays, for the CTs and all those things. Excellent people out there. Amazing network of Medicaid thorough professionals in this hospital. Thank you all. Thank you so much for taking care of me. God bless you all.